Welcome to the Prospective Doctor Podcast, brought to you by Med School Coach. Pre-med and medical students alike are encouraged to tune in each week for tips on how to become a strong med school candidate, gain acceptance into the school of your dreams, and succeed on your journey toward residency and becoming a doctor.
Hello, everyone. I'm so excited today because this is Erkeda here with a very special guest, Dr. Jade Anderson, who is a radiology resident. I'm going to have Jade tell us a little bit about herself.
Hi, Erkeda. Nice to see you. My name is Jade Anderson. I am originally from Chicago, Illinois, the south suburbs. I went to Hampton University for undergrad, class of 2011. And then I went to Boston University School of Medicine, where afterwards I did orthopedic surgery residency at The Ohio State for 2 years and realized that maybe orthopedics is not for me and made the switch over to radiology, and I'm currently in Connecticut.
Thank you for that. And that seems like an interesting journey, switching from one residency to another. Can you explain to us what initially drove you into orthopedics?
So I knew I wanted to be a doctor since I was 4 years old, and then I decided on orthopedics when I was 10. So honestly, I was just taking the next steps to do what I wanted to do. I felt like orthopedics fit my personality type, and I fit right in with all of the orthopods. It was kind of like, a little bit of a boys' club, but I'm also a little bit immature as well. So I really enjoyed all the operating room too. So, going through medical school and rotating on orthopedics, I said, this is what I want to do for the rest of my life. I'm going to be a world-renowned orthopedic surgeon, shoulder surgeon specifically, because that's my favorite joint. And, being a resident, I said, I think I found the imaging, because, it's ortho. We have images for everything that we do. And I found myself enjoying the imaging aspects and enjoying reading, because I interpret my own as ortho, maybe wait for the MRIs a little bit, but I still try to interpret them myself. And looking back, honestly, I took a MSK radiology rotation as a fourth-year medical student, and the chair of the MSK department said, "Why aren't you doing MSK radiology?" And I said, "I'm doing ortho." And then on top of that, I also volunteered to teach the MSK section of the third-year radiology residents' radiology rotation. So I taught that. And on top of that, as an ortho resident, I taught the first and second-year students at The Ohio State MSK radiology while I was an ortho resident. So I've been teaching radiology the entire time. I think that I have my blinders on. I said I was going to do something and I did it. And I realized maybe that was a mistake.
That's a really good point. And just to point out for the listeners out there who may be pre-meds and haven't gotten into anatomy yet, MSK is the musculoskeletal section. But I love how you said that you took an inventory and you were realizing hey, I'm an orthopedist, but I always find myself looking at images and I want to teach those courses and I want to learn more about that. And maybe orthopedics may not have been what I wanted to do. And that has to be a bold move because you put so much time into trying to get to where you were as an orthopedics resident. It's very competitive. So you had to study and you did all of this time of undergrad school and research and med school, and then you matched, and then you got there and you were like, this isn't for me. How did that feel?
It was awful, to be honest. I was like, is it just me? This is an 18-year decision in the making. That's not a small thing. I felt kind of like, I've never been married, but I'm assuming it felt like a divorce. And I basically reached out to some ortho friends that I knew who had also switched from orthopedics and went into radiology, one of them being my close friends from BU. And he had went to UCLA for ortho and then switched to Johns Hopkins for radiology. And he gave me a couple numbers of other residents that I could talk to that did the same. And everyone I spoke to, what they described as what they were experiencing during ortho residency was exactly how I felt. And he said, you know what, just make the switch. He said, you're going to love it. I think you need this change. And I said, okay. that's what I'll do. So I literally waited till after match day because I wanted people that actually, applied to radiology, got whatever spot they wanted. And I sent out over 100 emails to programs across the country. I didn't care because I just, needed a job come July. And after a couple months, I heard back from 4 places, and I happened to actually where I am now, they told me they weren't accepting any, new residents for that class to start in July, but someone wrote me on Aunt Minnie, which is like the radiology forum board. And they said, hey, I heard there's an opening here. So I said, that's interesting. So I reached back out, and Dr. Strauss, who was the CEO of our group, called, and he said, how did you hear about that? And I said, well, somebody wrote me. And then he said, well, I can neither confirm nor deny at this time, but I can get back to you in 2 weeks. And so he called me in 2 weeks, and it was an impromptu interview. And he's like, well, I'd like to invite you for a formal interview. And I said, actually, I'll be up that way for my birthday for vacation. So I stopped there on my way up to Boston and had half a day interview. And the next day they offered me the job, and I wasn't going to wait to hear back from the other places because this is now the beginning of May and I need a job for July. So, and I got the vibes when I was there. I said, this looks great. And so I accepted the position, and I'm so happy. And it's funny. I know. My friends see me and they're like, oh, you look so happy. And I said, well, why didn't you tell me that before? What did I look like before? So yeah, it was a good decision.
I'm glad that you brought that up, because this brings up a great topic in a lot of realms, not just with switching residencies, but even in the application process to medical school or application to residency, or even when you're an attending. And sometimes we get in the zone of creating goals for ourselves and accomplishing them. And sometimes you need to take a step back and do a self-evaluation and say, is this making me happy? And if it's not, you look into other avenues as to how you can utilize your skills and your gifts to find what makes you happy and what brings you joy. And it's great that you were able to do that with such ease, because from what I've heard, I have never actually switched a residency, but I heard it's not very common to do.
Surprisingly, radiology, I found actually a whole network of people who have switched specialties. And I feel like we don't talk about it very often. I don't know if it's because more of a taboo thing. I don't think it should be taboo at all. One of our chiefs last year switched from OB-GYN to radiology. Dr. Strauss, who is the CEO of our group, left medicine at Yale and then did radiology at Yale instead. There's a whole network of people who switch. And I said, wow, this is interesting. I didn't even know that was allowed. You know what I mean? As a medical student, I'm like, that's not a thing, but it's a thing. So I have actually helped a few people become kind of this mentor for people that have started residency, maybe aren't happy, want to think about something else or switch out. So I've become that person for them to talk to, and it's kind of becoming my little niche.
That's awesome. It's always great to have a network of people that you can collaborate with and learn from. And in this day and age where we have the social media, where we have these networks going on and these platforms where people are connecting with one another, like you said, you didn't know it was possible as a student, but now we're bringing things out into the forefront. So that would be great for anyone listening to know that it is possible. And if you're not happy where you are, there's a chance that you can find something that brings you happiness and joy.
Absolutely, yeah.
At Med School Coach, we know that getting into medical school is hard. In fact, 60% of pre-meds who apply to medical school don't even get accepted. And if you want to get accepted into a top medical school, it's even harder. It's a complicated process, and even students with great grades and MCAT scores get left out. That's why more students than ever are turning to Med School Coach for admissions advising. Our advisors are all physicians and former admissions committee members, so they know exactly what medical schools are looking for. One-on-one admissions advising from Med School Coach makes all the difference. Our expert team will help you develop a game plan, prepare your application, edit your essays, and coach you for interviews. Every pre-med has a story, and we'll help you tell it so you can stand out from the crowd. Visit us online at medschoolcoach.com and use offer code PODCAST10 to save 10% up to $400 on a Med School Coach admissions advising package. You can achieve your medical school dreams, and Med School Coach can help.
Now that you are in the program, was it difficult to transition from being an orthopedist to being a radiologist?
For sure. So first of all, anyone going into radiology, they don't teach you any of this in medical school. So the fact that you're also trying to figure out radiology at the same time of I basically left medicine in the dust, right? So I think I did like 2 sicky rotations as an intern. I did my last medicine rotation as a third-year medical student. Like, I think I did geriatrics as a 4th year, but I said, medicine, whatever. I'm going into orthopedics, I'm orthopod. So I'm trying to come back and I'm trying to remember medical terms and like all the ways that these different diseases can happen, because as a radiologist, you are the physician's physician.
Yes.
So they rely on you to know what the surgery was. How does it look on imaging? What are the complications? What is the differential for these lesions? And I said, wow, this is a lot of medicine. I now have to go back and review and relearn. And I think my program director was a little concerned up front, but then, once call hits as a second year, we take independent 24-hour call. So you either need to know or you may hurt a patient, which is also never, something you never want to do, because they have to, you are the radiologist tonight. We're the only radiologist in the hospital. So you're making final decisions for these strokes. You're making final decisions for anyone bleeding out. You know what I mean? Mm-hmm. So I picked up very quickly and everyone was really happy. They were like, oh, thank God. Like, we were concerned for a minute because of course my MSK was on point, but I had to remember there's everything else in the human body. And so they're very pleased with how far I've come along.
Absolutely. That you are completely right. Like, as a primary care physician, and I know a lot of people like to think of this, we think of like radiologists as one of the most intelligent fields of the spectrum, because we really do rely on you to complete that picture and give us this advice without seeing the patient or seeing the vitals. Like, right. you create an entire story with an image, and it's just fascinating to me.
Yeah, I appreciate that you said that. I didn't realize we were, because, we just feel like the ED's calling again.
No, you're really needed.
Yeah. Perfect. Thank you.
Your differentials are definitely on point. You think of things where you're like, oh, maybe it could be that. We should look into it.
That's awesome. That's awesome.
Yes, radiology is a wonderful, necessary field. Speaking of that, for students who may be interested in exploring radiology, what do you think would make a good student, a great applicant?
So, being that I didn't traditionally apply into radiology, I can't give the perspective from someone interviewing. I will say, from someone who does interview medical students, it's the usual things that you look for. They look for your board scores, which I think step 1 is now pass fail. So I'm assuming it's going to rely now on step 2. So I don't know what the purpose was with step 1 with that. A. B, we definitely look at your dean's letter and your grades on your rotation. So I feel like I personally look at those. I glean a lot from those because it tells a lot about how you work with other people and how you treat patients and interact with, other healthcare staff. So I think those are really important. And, C is basically the interview and how do you interact with, now I know radiologists are like, oh, you guys sit in the dark, you're boring. I am not boring. I have a personality and my department loves it. So we are in there like chatting it up, like, hey, do you want to see this case? And, all this stuff. We do love our technology. We're big nerds when it comes to technology. But, you don't have to be an out there person. That's fine. But we do want to see how you interact and are you normal? Whenever you're interviewing for residency, everyone just wants to see, are you going to be a team player? Because you may not be able to go home at 5 o'clock, right? Like you may have to stay and help out with other things. Do we have each other's backs? Do we want to hang out with you after work? So I think that's important too.
That's good. That's good to bring up because a lot of people do think about exam scores and that does not compose a whole person. When you're in residency, you spend a lot more time with these people than your family and friends. They become your extended family and friends. Right. You're doing 24-hour calls with them and you're with them every day. So it's someone to see like how you interact with the team. And is it someone that you would want to, of course, entrust the care of patients to, but also want to spend time with and learn together. So that's a very important aspect of displaying the personality, looking at the dean's letters and the summary of what all of your preceptors and letter writers have said about you through other rotations that aren't necessarily like a radiology elective or your medicine rotation. You may have a letter or something from OBGYN, and as they put your summary up. So that's why it's important to take each rotation seriously and put your best foot forward, because even if you don't want to pursue that particular specialty, those impressions matter.
Agreed.
Yes. And you said that you are going to be interviewing for this season. And of course, we're in 2020, so we know it's a different type of season. Are there any things that your program is putting in place to supplement this new COVID interviewing process, and how will that change?
No one is interviewing in person that I've heard of. So every single program, residency and fellowship, are doing virtual interviews. I'm currently applying for musculoskeletal fellowship right now, and all of my interviews are virtual. So, which is really hard, to be honest, because as I was saying earlier, you can't go and see how, the radiology department interacts, as a unit. You can't go and see, the MRIs and what the hospital system looks like and just get like an overall picture. It's really hard to do. So honestly, they're literally just going off of your interview, which is completely virtual. You know how in person you can read a crowd, make jokes and fit in. This is not going to be that way. So I think it's going to be a little tough, to be honest, for medical students, and they're going to rely more heavily on those board scores, on those letters of recommendation, on those grades that you got, only because they can't gauge how you would interact with a group, because you can't. It's all virtual. So I actually feel bad a little bit for the medical students coming, to be honest, in this upcoming cycle. It's going to be tough for them. With that being said, I think it's a lot more people are applying to more places because they don't have to travel. So they're saving money. So that does open up a little bit more places you may not have even thought to apply to, like somewhere in California. Now you don't have to travel to California. So with that respect, I think that's a little bit more helpful. So yeah, I'm curious to see how this goes, even from our own end, how we're going to interview, because I'm actually putting it together myself. And I said, wait, we can't start at 8 a.m. I said, what if we have a student from California or Colorado? That's going to be 5 a.m. for them. So I said, do we just only invite them for a specific interview day, and so that we can start at 10 a.m. or 11 a.m. for them? So there's a lot of little stuff going on, and hopefully it goes off without a hitch. But IT is always in the background. So
that's very fascinating, because I didn't think about that personally. I work for a company that is based on the West Coast, and I am on the East Coast. And it's very interesting how we navigate putting our meeting times, because we're in all 50 states and Hawaii. So it's like, okay, when it's 11 o'clock in Seattle, what time is it in DC, and what time is it in Hawaii, and what's that good sweet spot? So I can only imagine how that is to navigate with other students when you have your traditional interview day, where usually there's a welcome and there's a tour and stuff like that. How will you incorporate that into the virtual system, and how will the students be able to connect with you residents? Like, will you get a personal breakout session or something like that? So it'll be really interesting to see. But I think because of that, a lot of programs may be a little more lenient on some things that may have been a red flag in the past, like,
I agree,
they didn't make the dinner that sometimes they'll have the night before. Are they really interested? And things like that. So it may be a time to figure out how to connect as a human in different ways.
So I also know some ortho programs are actually doing a virtual happy hour the evening before instead. So they're doing some things like similar. Radiology doesn't really invite you the night before, not something we do. But with that, we're going to have icebreakers the day of, just to try to see how people interact and things. But the interview day will be a lot shorter, so that's nice. And I know that I think we're going to try to stick to, well, not us personally, but some programs have been talked about just asking standardized questions, so we can, based on how people answer, figure it out who we want more from that standpoint. So if you make it standardized and somebody answers better, then you have that to weigh against, I guess, as a scale. So that's also in the talks that I've heard about.
At Med School Coach, we know that studying for the MCAT exam can be challenging, especially for busy students on the go. That's why our team created MCAT Prep, the only all-encompassing study app built specifically for the MCAT. MCAT Prep by Med School Coach provides student access to extremely high-quality content and a personalized curriculum for free. The app has more than 250 videos, 1,000 flashcards, and 1,000 unique MCAT questions. Plus, MCAT Prep by Med School Coach allows students to create a personalized study schedule and track progress over time. You need every competitive advantage you can get to get into medical school, and now you can put the experts from Med School Coach into your pocket. It's the closest pre-med students can come to a personal tutor without spending a penny. Download MCAT Prep by Med School Coach for free at medschoolcoach.com/MCAT. Or download it directly from the Apple Store or Google Play Store. You can achieve your medical school dreams, and MCAT Prep by Med School Coach can help.
That makes sense. I really appreciate your insight on all of this, because I know just as you're in the process of helping develop these things and there's so much unknown, a lot of students listening are probably even more nervous because they haven't experienced anything at all. So it may give them some ease to hear that we're all in this together and we're all going to figure it out in this thing called 2020 and early 21, whenever you're listening to this podcast. But it's a process, and we're going to be flexible. And that's good that you can show that as one of your strengths.
Exactly. Yeah. So I would just say, I know personally for myself, when I was interviewing for orthopedics, I had a list of questions that I had already planned on answering. You know, tell me about yourself. That's a standard question. Tell me about your research. That's also standard questions. Students know your research. So I had written all of these out, and I'd written all my answers out. And the morning of, I'd wake up at 3 a.m. on interview days, because our interview days started at 6 a.m. And I would practice in the mirror and make it personable to that program. Why do you want to come to this program, et cetera? So I think being prepared is really key, and being prepared on Zoom as well is key.
I agree. I totally think that, of course, you want to be authentic and give actual like answers that you would give and not sound rehearsed, but you should always have some key talking points to get your point across. And sometimes practicing may help you sound not as nervous and kind of have ideas about what you want to say and not just ramble on like I'm doing right now.
it gives you a base, right? Yes. And you can always go off and say something extra. You can always say less. It just depends. You read the room, right? And so I think it's very important to be prepared. So
absolutely,
we'll see what happens. Yeah.
I really appreciate all of the points that you've given the students and telling your unique story of your transition from orthopedics to radiology and all of the things to come. And it's just very exciting to hear about all of the stuff that's going on right now in radiology, and apparently your future fellowship in MSK.
Yes.
So as we prepare to leave, I have one final question for you.
Sure.
What is one of the best lessons that you have learned that kind of sticks out to you about your journey through medicine?
So this is honestly a tip, and I know this may sound not so PC, but I would say trust no one, but just take everything with a grain of salt. So what I'm saying is, you know, if someone says, hey, I did this, blah, 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 you make sure to double check that it was actually done and save yourself some heartache. So that's all I'm going to say about that. And it's not that people should be trustworthy. People forget we're all humans, right? I don't think anybody's out to backstab you. I mean, some people are, but I don't think anybody's out to, you know, do the wrong thing. We're here for patients, right? So I would just say keep a healthy degree of, let me just make sure that was done. Let me double check. Double check is very important. That's what the final advice that I would give.
Okay. And I'm assuming that you mean in terms of being on the wards when
Anything.
People are, okay.
Anything. If they say, hey, I did this, like with the radiology the other day, like, I called the floor about this LP that we were going to do. Did you actually research the patient and call the floor about this? And this is like one of my juniors. No, it was not done. Okay. So you just have to just check, right? And just make sure everything is happening. I double and triple check at this point because you want your day to run smoothly. You want the patient to be safe. You know, this is why we're here. So just make sure to double check.
appreciate that. So that basically you're just saying cross your T's and dot your I's and make sure that what you are presenting as coming from yourself is actually accurate and correct. And you're right, that can go with anything, even these interview processes. Like make sure what you're putting on your CV and your application is correct and true and that you know what you're talking about yourself.
Right.
So
especially more and more as you become a senior resident, because you're in charge of interns, you're in charge of, it's a lot. And the attending will come looking for you, no one else. So.
Oh, yes. Well, thank you so much, Jade, for joining us today. And one day, hopefully, we'll have you back to teach us about some maybe MSK tidbits.
Yeah. But thank you for having me. This was wonderful.
Oh, thank you. And we're going to say goodbye for now, but I'll see you guys next week with another guest. Bye.
Each episode of the Prospective Doctor podcast is brought to you by Med School Coach. To access articles, videos, webinars, and free tools to help you succeed on your journey toward med school and beyond, visit our website, prospectivedoctor.com. We hope you tune in again next time.